My name is Hermann Einsele. I'm coming from Würzburg in Germany. I'm currently here in Frankfurt at the European Bone Marrow and Stem Cell Transplantation meeting. Now, I was asked to talk about targeted antibodies and CAR T cells in multiple myeloma. So there have been several presentations here on CAR T cells, mainly targeting BCMA, and the results, especially in patients with advanced disease, has been very promising. So in spite of the fact that most of these patients had been treated with all the agents available at the moment, they found that 50% of these patients achieved a complete remission. And in spite of that, these patients had received up to 8 lines of prior treatment. The progression-free survival was nearly 1 year, and in patients that achieved a molecular remission, it went up to 18 months, which I found extremely promising. And I guess that moving the CAR T cell therapy to earlier lines of treatment will further increase the efficacy of this treatment. Now, CAR T cell therapy is kind of challenged by the bispecific antibodies. Now, bispecific antibodies are antibodies that are also redirecting T cells, and we've seen very early data on bispecific antibodies, and also they have been successful in inducing not long-term remissions, but a lot of good remissions, and in 70% overall response rate, even in heavily pretreated patients at the highest dose that was given. So I think bispecific antibodies are going to challenge the CAR T cell therapy in the future, and it will be a very interesting race between these two options, with more data available on CAR T cells, with longer term follow-up on CAR T cells, but promising early data on bispecific antibodies. And I think both is very good news for our patients.